On 11th May 2017, the Democratic Republic of Congo announced that it was facing an outbreak of Ebola in the remote north of the country. With the epicentre of the outbreak deep in equatorial forests, more than 1,400 kilometres from the capital Kinshasa, responding to the outbreak presented huge challenges. Yet within weeks the last active case had been found, and by July 2nd the recommended follow-up period was complete and the outbreak declared over. The Democratic Republic of Congo has a long history with Ebola, which was first detected in the country in 1976. This latest outbreak in Bazuele province is the 8th the Ministry of Public Health has had to confront. Ebola claimed 4 lives in this latest outbreak, while another 4 people fell ill with the virus but survived. The expertise and capacity built during prior outbreaks enabled the country, together with the World Health Organization and other partners, to bring this latest outbreak to an end in record time.
We show other countries how Ebola can be controlled, and we must demonstrate how we do this with expertise and efficiency.
As soon as the alert was sounded in early May that people were falling ill and dying from an unknown disease with Ebola-like symptoms, the Congolese health authorities arranged for blood samples to be transported from the affected health zone to Kinshasa. Rapid testing for the virus was carried out in the country's laboratory facilities, which are equipped to enable detection of hemorrhagic fevers, including Ebola. When blood samples tested positive for the virus, the government immediately declared an outbreak. National emergency coordination mechanisms were triggered, and response teams arrived on the ground soon after. With very poor infrastructure in the affected zone, be it electricity, telecoms or roads, an emergency operations centre was quickly established in the grounds of a former convent in the affected health zone of Likati. Twice daily, the whole response team would meet to update and plan next steps. Coordination was led by the Ministry of Health, with full support of partners both on the ground and in the air to get supplies and teams to the affected zone. Generators, medicines, personal protective equipment and fuel all had to be airlifted in to ensure that the deadly virus was brought under control as quickly as possible. Suspect cases of Ebola were scattered across hundreds of kilometres of equatorial forest, with no access for 4-wheeled vehicles. Outreach teams had to travel by motorbike down narrow, bumpy paths and over precarious river crossings to monitor and treat the sick. Working together with local chiefs, WHO coordinated teams of villagers to rebuild more than 50 kilometres of road and bridges to reach Nambwa, one of the villages most affected by the outbreak. Even a small number of confirmed or suspect Ebola cases can mean identifying and monitoring hundreds of people who had contact with Ebola cases to ensure that chains of transmission are broken. Keeping track of these contacts involves working with huge amounts of information. As blood samples of suspect cases were tested in Likati, lists were updated and adjusted in line with the new information. At the Emergency Operations Centre, experts worked all hours to input the information as quickly as possible, analyse it, and use the results to guide the response. One of the first flights into the affected communities brought in mobile laboratory facilities so that blood samples of suspect cases could be tested within hours. When samples have to be transported long distances for diagnosis, it can mean delays of days or even weeks, hampering an efficient Ebola response. With extremely limited health facilities for people in the affected communities, Ebola treatment centres, where patients could be isolated and cared for, were rapidly established by partners, such as Médecins Sans Frontières. Some of the sick, however, who live in villages deep in the forests, had to be treated in the community. This Ministry of Health outreach team have come to visit the sick who can't be transferred to an Ebola treatment unit because the roads are simply not passable. Raising awareness about Ebola prevention is an essential part of stopping spread of the disease. Trained health workers and volunteers go door to door and visit markets, churches and other public places to teach people how to protect themselves from the disease and to prevent its spread in the community. Infection prevention and control is vital to stop the spread of Ebola. Health workers must follow strict protocols when putting on and removing personal protective equipment. Regular hand washing and use of chlorinated water becomes a part of life for communities affected by Ebola. The Ebola outbreak is declared over, but the country remains on alert for any new cases. The Democratic Republic of Congo continues to build on its experience fighting Ebola, strengthening health services and educating communities on how to limit and control future outbreaks.